Good morning and welcome to the California COVID-19 Vaccination Program Friday Provider Office Hours. This Friday, August 26, 2022. For the next 60 minutes, we will spend time during this session hearing more about California COVID-19 vaccine and some other items today. So as we move on to our next slide, we invite you to ask your questions. This webinar is indeed for you. So open that Q&A double talk bubble to ask questions or make comments, and our CDPH subject matter experts will be watching. And then to the far right of that, we have the chat feature, and that's where we drop important links for you. The most important link you need, though, is the link to today's slide deck. So if you open your chat, click on that, and all links are included in that deck. It's located on EasyIZ, but thanks to Blanca for putting that in the chat for you. Next slide. And to our panelists, please mute yourself when you are not speaking and continue to monitor that Q&A panel for questions you may be able to answer. We're so grateful for you watching over that and checking in with the Q&A coming in. Reminder to attendees, we want to let you know it is being recorded today. So this session can be found on easyiz.org/COVID/education. And you can also access not only today's slides, but past archived presentations. If you have any post-webinar questions, please email me, Leslie Amani, at leslie.amani@cdph.ca.gov. Next slide. All right, with our agenda today comes some announcements. We'll move on to the Kids Vax Grant 2.0 update with Thomas Villagomez, vaccine administration with Elizabeth Rayosti, clinical update with Dr. Katarina Liu, storage and handling with Kate McHugh, vaccine management with Eric Norton and Maria Volk, and then we'll wrap it up with some resources today, including some extra resources. So you'll want to make sure you stick around to the end of our presentation. Next slide, please. All right, moving to our first announcement, we want to remind you that the POM is available. This is the COVID-19 Provider Operations Manual. Please bookmark this comprehensive resource. This is a full-bodied, as we call it, the one-stop shop. There is so much information in here, including the many job aids that we've had on EasyIZ. We are sunsetting those job aids and we are putting them within the POM. So you'll really want to make sure that you have this available. And reminder, sharing is caring. Let others know what's available through the POM. Those bottom banner orange links are the live links. And speaking of, if you're new to the call, as we go through the announcement, would you give us a thumbs up if this is your first Friday provider webinar? We'd like to welcome you as we move through our announcements. So great, I'm seeing some thumbs pop up. Wonderful to have you on the call today. Wow, lots of new ones, we love it. If you would, open your Q&A and please put your name in the Q&A and where you're from. We'd like to welcome you by name if you are willing to do so, but happy to see so many new thumbs on the call. Next slide. COVID-19 Provider Operations Manual that I just mentioned. Here's an example of some of the information. Information on wastage and missed vaccination opportunities. So this includes guidance from CDC, links to job aids on reporting wasted vaccine, again, all inclusive within the POM. So please look for this and other helpful links, and it includes key points and that important reminder that we never miss a vaccination opportunity because of our fear of vaccine wastage. Next slide. Quality Assurance Quickenar series. We held 3 Quickenars. That is a 30-minute webinar, Quickenar. Archived recordings and slides are available for the subjects of storage and handling, vaccine management, and clinical. If you are a new provider or an existing provider that is looking for a refresher, we highly encourage you to watch the slides and listen to the recordings. Next slide. Upcoming today, that's right, today we have a webinar with talking with parents about back-to-school COVID-19 vaccines with Dr. Emma Oliveira. And if you attended last Friday, Dr. Oliveira provided this webinar in Spanish, and you can watch the recording by using the bottom link there. In the bottom banner, you can learn more about the crucial conversations that Dr. Olivera is part of, but she is part of the hashtag Vacunate Ya. She is a pediatrician and leader in that series for that campaign, and we want to invite you to listen to her presentation today at noon. Registration link is on the slide and in the chat. Next slide. Next week, talking with parents about COVID-19 vaccines for infants and toddlers with Dr. Eric Ball, a primary care pediatrician and leader with the American Academy of Pediatrics, California, and hashtag This Is Our Shot. This is an important call. We really want to encourage attendance because statistically, as of August 22nd, only 2.3% of children under 5 in California completed their primary COVID-19 vaccination series. And we want you to attend as Dr. Ball discusses strategies to proactively discuss COVID-19 vaccination with parents of infants and toddlers. Next slide. VA 58 Trust and Safety Team updates. We want to always just remind you that you can attend biweekly briefings, and you can also report any mis, dis, or mal information to the rumors at cdph.ca.gov email address. And again, the topics that have been recent narratives are in red of mis, dis, and mal information, and trusted resources. If you look for that blue, really want to highlight that on the far right. Those orange highlighted links take you to CDC, ACIP, NIH, other trusted resources in English, in Spanish. So we want to combat that mis and dis and malinformation and boost vaccine confidence. Next slide. Stay informed on EasyIZ. And if you've never been on this page, that orange link will take you there, but under alerts, that orange banner, there's information about the bivalent booster. So that's the pre-order information. You can click on that link. Just above the alerts, you can see those quick links. Those are the icons for FAQs, provider office hours for the archives, training and training calendar. Next slide. COVID-19 vaccine provider FAQs, as I just mentioned on the prior slide, you can click on that link. It'll take you to FAQs, and our current was just updated yesterday, 86th iteration of these FAQs, and we thank you for your continued questions that help us understand what your needs are. New FAQs are highlighted in the yellow star and updated with the green star. So information about eligibility for Novavax COVID-19 vaccine and updated information on bivalent boosters. This and more available in the provider FAQs on EasyIZ. Next slide. Pfizer trainings have been updated. Okay, so we do want to let you know, we'll pause here because you see the slide usually every week, but starting September 6th, the Pfizer COVID-19 trainings will be hosted on Teams, and there will be no password required. So again, just some changes. So watch carefully when you register. 2 more August dates available. And then that bottom banner link will take you to Pfizer's page just to ensure you've got the most current information. But please attend if you have not done so. And as we move on to the next slide, Moderna highlights those QR codes here for links to video resources for dosing of infant, toddler 6 months through 5 years, and for pediatric 6 years through 11 years. Next slide. Our updated training calendar is available with My CAVAX, My Turn, combined office hour events. There are view on demand opportunities. And of course, we're highlighting Monday's CDPH Therapeutics webinar for providers from 12 p.m. to 1 p.m. And then that crucial conversation special session on September 1st with Dr. Eric Ball. Next slide. Lastly, I just like to think ahead, and I want to remind you, as you are planning, please plan ahead for Monday, September 5th. It is Labor Day, and we will not be holding the planned usual My Turn, My CAVAX webinar. More information to come on the webinar's next date, but we want to observe Labor Day holiday. Next slide. All right, before I invite Tommy to give the Kids Vax Grant 2.0 update. Welcome, Irma from, it looks like Stanley H. Schwartz, Tessa from Madeira. We know Madeira very well. And we have Oscar from YOLO. YOLO, we love that. You only live once. Love it. Oscar, welcome. Jesse from San Luis Obispo, Slow. Amani from San Benito. I'm familiar with that name too. Actually, welcome, Amani. Mark from Partnership Health Plan of California. Regine from Lakewood in LA County. Sapana from Downey in LA County. We're so glad to have you on the call today. And as we move on, reminder to ask your questions of our CDPH subject matter experts using the Q&A. With that, I'll turn the mic over for the Kids Vax Grant 2.0 with Thomas Villagomez. Tommy.
Thank you, Leslie. Good morning, everyone. My name is Thomas, and I am just going to do a brief promotion of our latest grant opportunity that we are partnering with Physicians for a Healthy California, PHC. Next slide. So this grant is what we affectionately refer to as Kids Vax Grant 2.0. We have appropriated about $10 million to support providers that apply for the Kids Vax Grant 2.0. And providers that participate in this grant are eligible to up to $35,000 if they are providing services to pediatric populations and administering the COVID-19 vaccine to that population. Next slide. So there are two components of the grant. The first is for providers that are newly enrolling into the state's COVID-19 vaccination program, or MyCAVax, and that is a $10,000 grant opportunity. And then the second component of the grant is for expanding clinic hours by 25 hours per site. Next slide, please. So for to be eligible for the $10,000 enrollment grant, providers will have had to enroll in MyCAVax between December 17th of last year, 2021, and through October 15th of this year, 2022. That date, it might be a little bit deceptive, and the latter, the October 15th, and I will explain why in just a bit. But for that $10,000 enrollment grant, providers need to have placed one completed order of COVID-19 vaccinations for the infant and toddler population, so 6 months to 5 years old. And for the $25,000 expansion grant, providers need to have expanded their clinic hours by a total of 25 hours. And this is a one-time and a temporary expansion of clinic hours, and they do have to be outside of normal or existing clinic hours. We do understand that that is quite a lot of time to extend clinic hours by. So these hours have to be completed within 120 days or approximately 4 months of the application's approval. But unfortunately, those hours are not retroactive and must be completed after the grant's approval. And similar to the $10,000 enrollment grant, providers have to place at least one completed order of COVID-19 vaccines for that infant and toddler population, 6 months to 5 years of age. And as Leslie mentioned, only about 2.3% of this population has had their primary series for COVID-19 vaccines. So the goal behind this grant is to increase that number. For both installments of the grant, the funds have to be allocated on allowable expenses. That said, PHC, our partners, Physicians for a Healthy California, have seen some pretty creative ways of using those grant funds to encourage vaccination. So the allowable expenses can be pretty flexible and creative. Next slide, please. Okay, as I mentioned before, that October 14th deadline might be a little bit deceiving in terms of maybe a provider's rush to complete the grant because it seems far away. But of this $10 million that we've already appropriated, already over $8.5 million. So we're $8,515,000 of those grant funds have been applied for. Most of it has been for the expanded hours, the 25 expanded clinic hours outside of the normal and existing clinic hours to be completed within approximately 4 months. As you can see there, about $8.4 million, a little over that. And then a much smaller $90,000 have been allocated for enrollment. Next slide, please. Oh, sorry, Leslie, but if you have any questions, go ahead and visit PHC, their website. It's kidsvaxgrant.org. My apologies, Leslie, I'll turn it back to you.
Thank you, Tommy. And Tommy will go ahead and add that web address into the chat for all of you. And oh, it looks like we've already got it there. So this is fabulous. Thanks for that update. And we appreciate Thomas Villagomez being on the call. At this time, we'll look to the vaccine administration data update with Elizabeth Riosti. Liz?
Thank you, Leslie. Good morning, everyone. Next slide. So as of this Monday, August 22nd, we had administered a total of 79.4 million doses. So again, we're edging up towards that 80 million dose mark, which is pretty exciting. Next slide, please. This past week, we had administered just under 150,000 new doses. You can see on the chart on the bottom the change in terms of the number of new doses going to different age groups. So we saw a pretty significant drop in the number of new doses going to our adolescent and pediatric age groups, and a slight drop in terms of the number of new doses going to the 50 and older age groups. Next slide, please. We wanted to once again give a comparison here to put in context the California Vaccine Administration data and just show you a comparison of where California stands compared to the rest of the country. So this graph is just showing that across all age groups, California is either meeting or exceeding the nationwide primary series completion rates, which is pretty remarkable. And when you look at the sort of adolescent and pediatric groups, we're far outpacing the nationwide rates. Next slide, please. And then looking at California compared to not just the rest of the country, but some of the other most populous states, you can see here that California in orange and New York State in dark blue are sort of leading the way, far outpacing the rest of the country in most age groups in terms of primary series completion rates, and doing significantly better than Florida and Texas, two of the other most populous states, particularly with those pediatric and adolescent age groups. Next slide, please. Speaking of those, the adolescents, among infant toddlers, we saw 9,800 new infant toddlers initiate their primary series this past week, which is a reduction compared to the prior week. So the past few weeks have seen a reduction in terms of the number of new infant toddlers beginning vaccination. Next slide, please. And when we look at the infant toddlers who have started their vaccination, we do see that infant toddlers living in quartile 4 zip codes, so those are those zip codes considered more healthy, that they're almost 7 times more likely than infant toddlers living in quartile 1 zip codes to have started their primary series vaccination. So there's a 14.8 percentage point gap between those in quartile 1 and those in quartile 4. Next slide, please. And once again, just comparing the under 5s here to comparing the rollout of this vaccine to the 5 to 11 vaccine, which became eligible, the 5 to 11-year-olds who became eligible back in November. We're at about 8% of infant toddlers now who have at least started their primary series. And when the 5 to 11 vaccine rolled out, They reached about 8% of that age group starting their series at about day 13. So that age group certainly was, there was much quicker uptake amongst 5 to 11-year-olds compared to what we're seeing for under 5s. Next slide, please. Just a summary here, 79.4 million doses administered, 150,000 new doses administered this past week. 8% of the population under 5 now has at least 1 dose of vaccine. Just about 10,000 new infant toddler recipients this past week. And 71% of the population 50 and older has received at least 1 booster. And that percentage ranges from 62 to 80%, depending on which race and ethnicity group you're looking at. That is it from us, but we will keep an eye on the Q&A in case there's any questions.
Thank you so much, Liz. We'll move right along, and we are seeing your questions coming in. Thank you so much. Continue to ask your questions. And we are going to move on at this time with some important clinical information from Dr. Katarina Liu. Katarina?
Good morning, and thank you. Next slide, please. So I wanted to briefly talk about some updates related to the bivalent booster vaccine that you heard Leslie talk about earlier. We anticipate they'll be available possibly as early September after Labor Day. And they will contain the current vaccine composition plus the Omicron BA4, BA5 spike protein component. They will be available from Moderna and Pfizer, and the Moderna vaccine bivalent booster is anticipated to be available for those 18 and older, and the Pfizer for those 12 and older. Next slide, please. Pfizer and Moderna both submitted requests to the FDA for emergency use authorization in the last week for their updated booster. And it would be administered as a single booster dose to those who previously completed a primary series, but would not vary by number or prior doses of booster received. So we're not thinking it's going to be called a second or third or fourth booster or anything like that. But I just wanted to remind you that EUA hasn't been granted by FDA, although we anticipate it's coming soon. And then ACIP, so CDC's advisory committee, will also need to make a recommendation. ACIP is meeting late next week, so next Thursday and Friday. So we anticipate there will be a lot more information from those meetings in terms of clinical guidance and recommendation. So stay tuned. Next slide. Next, going to another COVID-19 vaccine, just an update on the Novavax vaccine. On the 19th last week, FDA expanded EUA for the Novavax COVID-19 vaccine to be used in adolescents 12 to 17 as a primary series. So as a reminder, it was previously in adults only as a primary series, and now adolescents are added. The dose is the same for adolescents, the 5 microgram recombinant spike protein and 50 micrograms of the Matrix-M adjuvant. And in the clinical trial, the efficacy was 78% at a time when the Delta variant was predominant. And the side effect profile was similar to that seen in adults. So just injection site symptoms like pain and tenderness, headache, fatigue, malaise, those kind of reactogenicity findings that you saw in adults. And most were mild to moderate and lasted less than 2 days. Next slide. So we wanted to highlight that the CDC and CDPH COVID-19 vaccine schedule and timing has now been updated with the new guidance for Novavax, and will be updated again very shortly with the new information about the bivalent boosters. I also wanted to note that you may have questions about Novavax as a booster. It's not authorized yet, although the company did submit their request for their vaccine to be used as a booster. So stay tuned for that as well. And that ends my update, and I'll hand it back to Leslie.
Thank you, Katarina. And I'm just going to ask Mac's question very quickly. He was asking for the bivalent booster doses. Will the dosages remain the same? 0.5 mil for Pfizer, 0.25 mil for Moderna.
That is our understanding, that the dose would remain the same as the current booster dose, but it would just be a new formulation.
Thank you, Dr. Liu. And I'll give Dr. Liu an opportunity to review other questions that may come in. So as we move on to our next presenter, we invite you to ask your questions But now we're going to hear a storage and handling update from Kate McHugh. Kate?
Thank you. Next slide, please. So for the bivalent booster storage and handling, I just wanted to let you all know that the storage and handling should be the same as the current products available for Pfizer and Moderna. So for Pfizer, you will have long-term storage in your ultra cold freezer and should also have the 10 weeks in refrigeration. And then Moderna, long-term storage in your standard freezer, and then the 30 days in the refrigerator. The final details, though, will come with the EUA. So it's going to be really important to make sure you read the EUA when it comes out. And we will also update our job aids to make sure it includes the most up-to-date information. Next slide, please. And with so many more people getting boosters, likely if these are authorized, they also may have all of the spots on their vaccine record cards filled up. So if a person does present at your clinic with a full vaccine record card, this is the process that CDC has given us. You should complete a new card for the patient, then staple both cards together. And you should also encourage the patient to photograph both cards just in case they become separated. And the patient should bring both cards to future vaccination appointments with them. And I did want to note, so for those of you who don't regularly order ancillary kits, if you don't have a large stock of vaccine record cards in your clinic, it may be worthwhile to order an ancillary kit just so you can get extra vaccine record cards, because that is the only way to get the cards, is to have an ancillary kit delivered to you. So that's just something to think about, because it's possible you may have more patients showing up who need a card. Next slide, please. And another reminder, just that you can also recommend that patients download and use their digital vaccine record, and the link to that is here. That's another way for patients to have a copy of their record with them on their phone. And that is the end of my slides. So back to you, Leslie.
Thank you, Kate McHugh. We'll move right on to our next presenters. And on our next slide, we will find the vaccine management updates with Eric Norton and Maria Volk. Eric?
Thank you, Leslie. Good morning, everyone. Let's go next slide, please. Okay, so just a recap. Again, we did have a release 29.1 on the night of August 15th. You'll find in My Turn Public that we had an eligible flow for monkeypox vaccinations for 18 years and older. For those under 18, we're asking you to just keep those locally, and then we'll get those uploaded or input after our next release, which is next week. Patients can view and use the eligibility interactive chart, both desktop and mobile versions. We're encouraging y'all to go check that out. It's a helpful tool that you can probably borrow and use for your own activities as well, but it's a great way of finding your way through the eligibility checklist. Over on My Turn Clinic, vaccine administrators can now identify an existing patient record and when creating a walk-in appointment, and then reuse that, which reduces the chances of duplicate records. So when a patient's in the walk-in flow, when you enter the name, first name, last name, date of birth, the system will check within My Turn, because it is confined to the My Turn data at this point, but it'll look for other matches with that same name, first name, last name, date of birth. If there's one match, it'll just pull that data across. You can confirm that information, or if it's not the right person, you can overwrite and keep moving forward, with the exception of first name, last name, date of birth. If there's multiple matches on that, you'll see them both all present, and you have the ability to select the correct match, and then again, that just pre-populates the record, saves you time and reduces duplicate records. For the walk-in appointment flow, we have walk-in appointment flows for COVID, flu, and monkeypox, and now they have the gender field that we added to that. We now have the ability to collect that information. And then also with clinic managers, you can create monkeypox, MPX, Jynneos 18+ vaccine supply, vaccine inventory, editing the IAS MPX appointment records, filter, single edit, and cancel the MPX Jynneos 18+ appointments as well. So you get full feature for the clinic managers. Again, we're looking at adding the minor flow with our next release. Next slide, please. All right, we've had some questions with that release of the monkeypox clinics. It's just kind of where the information is on how to kind of orient yourself to it. Again, if you are familiar with how to set up the clinics and manage clinics, this should be a really easy transition for you. But if you're looking for a refresher on there, please do go under the Knowledge Center. We do have items 2 through 3 are preceded with monkeypox for some quick sheets and data and other walkthroughs on that, but also just to kind of refresh on the appointment management and clinic setup, because the clinic setup now includes monkeypox as MPX as an option for those clinics, and you can add those. You can have a combination monkeypox COVID clinic, monkeypox COVID flu, whatever you want to do with that. So next slide, please. All right, and then again, we're expanding our access to the data, the monkeypox data and MPX data in MyTurn with our next release. But as part of the release last week, we did include for you the patient export report. And then within that, you have also the sexual orientation and gender identity information as well. So it'd be the MPX vaccination record, and then any sexual orientation and gender identity information with that. So you can run those data and report back to your locals and higher ups with that information out of MyTurn. Next slide. Okay, so with regards to our upcoming priorities for MyTurn, we're focusing on releasing the bivalent COVID vaccine booster dose functionality. Now, again, what we're thinking here is we want to get this out. We, we're all seeking, thirsting for information on what the approval is going to look like. How is there going to be limitation, restrictions? Are they going to go with certain age groups? We don't have any of that information right now, and we are combing for that. But because of that, we are looking to go live in our next release, which is on August 31st, with the ability to do the bulk upload and inline edit. So you can process it that way. And then we're going to have to, based on what the approvals are, we'll come out with the actual flow just a little bit after that, because again, we have to make sure that we're building in. Again, we can't build the system without the requirements on that. So our fast way to get that out is with the upload and inline edit, and then we'll follow after that. And then for clinic, we also have the Novavax vaccination data. Right now, you're collecting that offline using the CSV. You'll have the ability to upload that, and also we'll be deploying full feature Novavax functionality as far as booking appointments, and also in the clinic as well, August 31st. Next slide, please. Maria.
Great, thank you, Eric. Happy Friday, everyone. So as hopefully everyone knows, we did release the pre-order for both the Pfizer and Moderna bivalent booster products that opened on Monday. We have pre-orders that are going to stay open until today, this Friday. So if you have not done a pre-order, please do so by the end of today. As we've talked about in other sections of this call, we are anticipating approval of those vaccines right around Labor Day. And at the moment, we are expecting those doses to start shipping and arriving the week after Labor Day, so September 6th through 9th. Sounds like Pfizer's actually going to ship doses on Labor Day for arrival on the 6th, and Moderna likely the 7th and 8th would be the earliest. So a window there. If we get any more detailed information as we get closer about that window, we'll let you know. But for now, would expect those doses to be arriving that Tuesday through Friday after Labor Day. And of course, it's going to depend on how many orders. There have been times with different product releases where it's taken a bit longer, just depending on how many orders, and other times they're able to get them out within a few days. So we're expecting some pretty good interest in these products. So we expect they will be quite busy that week getting those doses out. Next slide. And then just for your reference, this is the calendar that we sent out, again, referencing the pre-orders, and then that anticipated delivery that 6th through 9th. And again, if we get any more information that updates those windows, we will let you know as we get closer to September. Next slide. Just a quick reminder, as you have any staff turnover, please make sure that you are notifying the MyTurn and the MyCAVAX help desk of any changes to your organization coordinators, your location coordinators, and or your CEO and CMO. It's really important for us to have the most up-to-date contact information, so please reach out whenever any of those change, and we will make sure we get the new folks set up properly in the system. Next slide. Wanted to let you know that the Novavax trainings have been added to the training tab in MyCAVAX. So now you will see those under the required CDC product training. Next slide. All right, as we move through the appendix, as always, just want to remind you, if there are any known issues, we'll have them listed here. And then we always include the product roadmaps for both MyTurn and MyCAVAX. So if you are interested in more details about our current or upcoming releases, they are there for your reference. And with that, I will pass it back to you, Leslie.
Thank you. I'm going to not wrap up the whole webinar because I'm going to bring forward a few resources. We're going to have Q&A, and then we have a special section of resources right at the end. So stay tuned and hold tight. But we'll move to our next slide. If you have questions outside of this webinar, the additional support is available through the COVID-19 Provider Call Center email and phone number available to you Monday through Friday, 8 to 6. There is support through the MyCAVAX and MyTurn Clinic help desks. Again, information on how to contact them is available. We've included enrollment support, and we are encouraging providers to enroll in the California COVID-19 vaccination program. Any questions about that, please email mycavacsinfo@cdph.ca.gov. And then archive communications are available on the EZIZ archive communications page. Next slide. A reminder, I did reply to our new attendees, welcome, and this is the reminder that I sent back to you. If you are new or existing and are not part of the provider listserv, you want to email blanca.corona@cdph.cav. ca.gov, and that will give you insight to important reminders, alerts, updates, and a weekly wrap-up, which is a summary of what's going on for COVID-19 vaccine. So we really want you to get these messages. If you sign up, you'll be added, and please watch. If you're not receiving them, check your other inbox or your spam and make sure that you are allowing these emails to come in. Next slide. California Department of Public Health, latest updates on their California Department of Public Health immunization webpage. You can find quick tips for fighting COVID-19, protecting your health. These are helpful resources to share out with the public, so we invite you to take a look. Next slide. All right, we're going to jump to Q&A with Maria Volk, and then I will use a little time at the end to share some other resources. Maria, right over to you.
Great, thank you. I will take this opportunity to jump in first with a question that I saw Christina answer, and that I meant to say when I was talking about the MyCAVAX orders. So the question was, what happens if people miss that pre-order window? So if someone does not submit an order today, what will happen? So any orders that are submitted and approved after this pre-order window will be processed just as soon as CDC opens up ordering again for the bivalent boosters. So basically we'll hold those orders until CDC opens it up. And we are expecting that once that EUA is approved, they will open it up right away. So we would expect that then those orders would ship once they finish the wave 1 and wave 2. We don't have a lot of information about kind of what that delay will be between those initial pre-orders and orders that come in after, but just wanted to let everyone know that we won't close ordering, we'll keep it open, collect those and then send them all to CDC just as soon as we get that green light. All right. Tommy, I know you answered a bunch of questions. So let me just check in with you and see if there's anything in particular you wanted to highlight for folks.
Hi, Maria. In terms of the Kids Vax grant,
Yes.
let's see here. We got some questions about the number of sites or whether or not there was a cap. And the answer is no. There is no cap on the amount of sites that you can apply for. And then also, we've gotten a lot of questions all in the past as well about how long the application takes or before funds are distributed, and it is about 30 to 45 business days.
Great, thank you. All right, Eric, one for you. Will the bivalent booster be a different product that we will need to add to our MyTurn clinics inventory before patients begin to schedule? We don't want our clinics that offer current Pfizer Moderna booster appointments to get booked up if we haven't received the bivalent booster yet.
Yes, it will be a different vaccine inventory that you have to add to that clinic.
Great, thank you.
And then also just the other question by Elaine Yan, is there a list of medical screening questions for monkeypox? Again, you know, it's right at this point, it's the, you know, are you feeling sick? Have you had allergies to Jynneos or a component of the vaccine? Are you pregnant? Have you a weakened immune caused by HIV? And then also, have you previously received a dose of smallpox, ACAM, Dirax? Those items. So yeah, there are those screening questions. And again, that's the ones that we're pulling off from the, again, through the EUA and a couple of items as well.
Great, thank you. Christine, I see you're typing an answer, but maybe I'll ask you to just go over this one verbally. The question from Mac was about our pre-orders just for standard orders or for small orders, but maybe you can talk a little bit about what we're anticipating for small orders.
Yes, so the pre-orders is just standard orders for fulfillment through the CDC. But if your local health department is participating in small orders for local distribution, once they configure that in the system, you'll be able to submit a small order for the product. But of course, the distribution would be in September once the vaccine is received. But for now, the pre-order wave that we have is for standard orders through CDC.
Great, thank you so much. And Kate, one for you. And the question was about the 5 to 11-year-old vaccine and kind of what the future status of that was.
Yeah, so right now, all of the Pfizer for ages 5 to 11 in the federal inventory. So that's the vaccine that the federal government has purchased and is what we send out to you all. It's all expiring, I think, at the end of November, and CDC has assured us that the product won't be going away forever, and that providers will be able to access it in some way. But right now, we haven't heard that they've made a purchase yet, and it's a little bit unclear if CDC is planning to purchase more or if it will potentially be available on the private market. But they have said it will be available in some form.
Great, thank you so much. I know we've gotten a lot of booster questions, and there's been a lot of things that we don't know yet that we're going to be waiting for ACIP, but let me just check in with our clinical team and see if there's anything that you wanted to highlight or say to the group based on the different bivalent booster questions you've seen.
This is Katerina. Just wanted to note that there were a lot of questions about intervals and who's eligible, whether it can be used as a primary series. These are all really great questions. We anticipate that we'll be able to share information with you after the ACIP meeting. So the meetings are next Thursday and Friday. So probably it will be the provider office hours meeting following that, that we would be able to give you the full update. But you can also watch out for the CDC's updated guidance and updated ACIP slides if you want like a sneak preview of what the recommendations will be.
Great, thank you so much. Let me just ask this and see if anyone can help answer. What can long-term care facilities expect with the vaccine booster in the fall? Will it be the same process as before through the federal pharmacy partnership?
From what we heard on the CDC call, it sounds like it will be the similar channels as before, and they don't plan on having any new programs, but we'll keep you updated when we have more information.
Great, thank you. I see Amy is typing an answer to this. Rita's question or comment was, don't forget to ask about a history of keloid formation as screening for the MPX vaccine so that you can determine between subcutaneous and the intradermal. Did you want to answer that one out loud for us, Amy?
Sure. All I was going to do was put some, and actually I can do it in the chat for everyone, some links to some aids that we have. One is a pre-vaccination screening checklist for providers that explains all of the screening questions, including the history of keloid scars. And another is a registration and consent form that we have for MPX, for MPOX. And both of those aids are available in English and Spanish. And I'll put the links in the chat.
Great, thank you, Amy, very helpful. Well, we're waiting to see if any additional questions come in. I know I checked in with a few of our subject matter experts, but let me just open it up and see if there are any other subject matter experts on the call that want to highlight any questions or just make any comments for the greater good.
Maria, one more thing about the Kids Vax grant. I went over how quickly those funds are going and that we have, less than $1.5 million left. And I think it's worth mentioning that grant, Kids Vax Grant 2.0, only started in August, or the 1st of August. So that gives an idea of how quickly those funds are going. So if anyone has any desire to apply, I definitely encourage providers to do that as soon as possible, because it's pretty likely that we're not going to see those funds last through the month.
Great, thank you so much. It is exciting to see so many applications for it and to see providers taking advantage of that opportunity. Any other questions that folks want to highlight for the group? All right, Leslie. So why don't I pass it over to you, and we'll both keep an eye on the questions and pop in if others come in. I know we still do have some time, so if you're typing a question, please finish that and we'll make sure we get to you before we end. But I'll send it back to you momentarily for the moment, Leslie.
Thank you, Maria. And this is a perfect opportunity as you are typing any further questions. We'll move on to our next slide because we want to just share with you some MPOX resources. We've added this special appendix at the end, so we'll move on to our next slide. And we wanted to highlight the CDPH monkeypox page. That's monkeypox, MPOX. You'll hear us refer to MPOX vaccine resources. It includes vaccine Q&A, vaccines page with resource links and the allocation process. There's information for local health departments. So some of you on the call, I think, are with local health departments, but those pages are available on CDPH. Let's move on to our next slide. And we have communication toolkits. What is monkeypox is a resource. So we want to highlight the English and Spanish on the left. It provides some information and explanations on Mpox. And then we also have fact sheets available through the communications toolkit, and it's in multiple language: Arabic, Armenian, Cambodian, Farsi, Spanish, Chinese simplified, Chinese traditional, Tagalog, and Vietnamese. So again, I know that you frequently ask, what languages do toolkits come in? This is a communication toolkit you want to bookmark. It has great information to share out with details, to share with community members, the public, on getting the facts and information and how we can best support as we are moving toward Mpox vaccine. Next slide, please. EZ-IZ Mpox vaccine resources. This page, note in the bottom banner link, includes information on intradermal, clinical guidance, vaccine information, storage and handling, standing orders, coding information, and a screening checklist. Next slide. And lastly, this is the CDC Mpox resource page. It includes information on CDC vaccines, JYNNEOS. The COCA call that is listed there was just held on August 11th. We've also added it into the bottom banner as an archive because we really want to draw your attention to what was discussed with CDC and FDA on Mpox vaccination. And then, of course, there are clinician FAQs, and then an intradermal injection video, along with the JYNNEOS updated package insert from the FDA. Next slide, please. All right, we're going to loop back to Q&A. I'm just highlighting at this moment that there is a provider therapeutics webinar on Monday at 12 p.m. And then the next session for My Turn, My CA Vax will be Monday, September 19th. Remember, we have that Labor Day holiday. So it's throwing cadence off slightly, but we'll loop back with My Turn and My CA Vax Monday, September 19th with providers. And then, of course, we're here every week on Friday at 9 a.m. So I'm going to pause and I'm going to check in with Maria or any updated questions you'd like to bring forward or any comments from our CDPH subject matter experts. They're welcome at this time.
Just one that I just answered that I think kind of piggybacking off of Kate's comment that if the Pfizer 5 to 11 becomes available through the private market only, would it be available to order via VSC? And yes, we do anticipate that in that next phase, whenever that may be, once things become in the private market, that there would then be an appropriation for those to be as part of VSC. Of course, products have to have full FDA approval to be part of the VSC program. So I think there's a whole lot we still don't know yet about timing and when that might happen, but I think those are a lot of the preparations that are starting to be thought about as, you know, the announcements of the eventual moving to the private market, you know, at some time in the coming months into 2023. So I'm sure much more to come over the next few months about that eventual transition.
All right, it does look like we're getting some questions in. And let's take a look here. We actually have a raised hand from Cheryl, and I believe we have enough time as our SMEs are answering the questions in the Q&A. Cheryl, if you would like to unmute and ask your question. And I just saw the hand go down, so maybe that question already got answered, but wanted to check in. And it does look like Dr. Liu and Maria are answering questions. So again, I will pause for our CDPH subject matter experts who are on the call. We have time if there is anything you would like to bring forward to our audience today. All right. Well, please stay tuned for further information as we receive it. Of course, we try to bring you the latest and greatest every week in terms of supporting your amazing ongoing efforts. And since we have a moment, I'm just going to throw this out there. Look for your reactions icon. Give a thumbs up if you're feeling a little bit overwhelmed and tired on some days. I just want to pause and acknowledge, yes, I'm seeing lots of thumbs come up. We certainly, oh, wow, so it's filling our screen. And by all means, we just want to take a moment today to really pause and invite you just to pause yourself and take in some inhales and exhales. We want to just invite you to breathe and slow down for just a moment. We know when we look back over the last 2 years plus, the tremendous efforts that are going on every day from each of you and your staff. And if you're new on the call, welcome to the program. We are so glad to have you join. But again, while we are not face to face, we are keenly aware of all the work that you are all doing, and we are so appreciative that you continue to join us on Friday and other webinars to hear what's going on. We value your questions and we value you and all you are doing. So I'll pause if there are any of our CDPH SMEs that would like to add on to what I've said or anything else as we are looking to our final moments together. All right. Dulce, it does look like you have a raised hand. We have a moment for a brief question. If you would like to unmute and ask your question of our CDPH subject matter experts, we can have you unmute and you can share your information. If you click your microphone from red to gray, you should be able to speak up. So we'll pause for just another moment. Not hearing Dulce yet. Grace, if you would like to unmute and ask a question, you can change your microphone by unmuting it. You have the ability. I see Dulce. Dulce, go right ahead. Unfortunately, not hearing anything. Grace, did you want to unmute and ask a quick question?
Hi, Leslie. I don't have further questions for you today. Thank you.
Thank you, Grace. All right. All right. Welcome, Latasha from Lake County. We're so glad you're here from Lake County, Latasha. Super to see so many new folks on the call today. All right, with just 2 minutes left, we want to again thank you for being here. Our heartfelt gratitude to our CDPH SMEs for creating slides and presenting, and a special shout out to the folks that are behind the scenes supporting this call, Rachel Jacobs, Blanca Corona, and Charles Roberts. Thank you so much. And to all of you, we thank you for your time, your attention. Please take care of yourselves. I hope you get some breathing space this weekend. We hope this webinar has been informative and supportive of your efforts, and we wish you all the best as we work together to vaccinate California. And with that, we'll conclude today's session. Thank you.